Wow, good evening, friends, and welcome to the Belonging Podcast. Belonging is part of the life journey, and it's brought to you by Green Hills Christian Fellowship. I'm actually right here in my office this evening, joining you live on YouTube and Facebook. Thank you for tuning in. I hope you can stay for an hour as we talk about Christmas. We heard some Christmas music in the background before we started this evening. And yes, Christmas 2020 is here. And we're going to be talking about Christmas in a COVID world. And to help us in our talk today, our conversation today, is the director of Hospital Infection and Epidemiology Center of the Medical City. Let's welcome Dr. Karl Henson. Good
Hi,
evening.
everyone. Good evening po. Thank you
Yeah,
for having me.
and thank you also. I know you're a busy man, and thank you for being with us. Um, Doc, siguro we can start by your observation or assessment. Bumaba ba na nga pang kaso, or is it still high, even though it's kind of dropped to around 1,000, for the past few weeks?
Right. I think it's best to really start from the beginning. I promise this will be short, but
Mm-hmm.
when we were first hit with COVID, no, there were like 3 cases, and then we thought, okay na. That was back in maybe, or even earlier, and then we had our first wave. It wasn't a lot of cases, but we had our ICUs were full at the time. In Metro Manila, there weren't a lot of cases in the provinces yet. And then we were able to control that wave. So there was a bit of a break. And then because people started to go out more, we were coming out of that very strict enhanced community quarantine. Um, People started to go to work slowly. We had our second wave. After that second wave, which was sometime around July, bumaba na ulit. At least in Metro Manila, we really felt, at least in the hospitals, that the cases were down. There was not a lot of patients in the ICU, and the wards also had some beds that were vacant. We were still getting new cases daily, but not as bad as before. But that's how we were dealing with it in Manila. But when we looked at the provinces, no, Davao was taking a hit. Cebu was also taking a hit earlier on. So I think the Philippines had it bad in different time points. Right now, our cases are still low, but news from the authorities seem to show that the numbers are slowly rising. This might be because we felt the low numbers of cases. We started to get comfortable, and might be because people started to relax a little bit. They've gotten used to the situation, or people just got tired of all the quarantine, etc. But it seems that there's some signal now that cases might start to rise again. You might have heard that if you've been watching the news, you might have heard, or even social media, you might have heard a term called R not being talked about, or a reproductive number. Um, Anything below 1 is good. It means that the cases are down. But now we're starting to approach 1 again, and it's the last number I heard was 1.06. That means for every one person who's infected, I will infect 1.06 more. So if it becomes, for example, if it becomes 2, no, then exponential na yun, because 1,
Exponential yung growth.
2, yeah, so that will be a really bad situation. And we were in that situation before, 1.6 or even higher. Ngayon, we're still in that sort of threshold na it's just going up. So we really need to be careful again. We should have been careful the entire time naman. But we need to be more vigilant now and be extra careful.
That's right. And lalong-lalo ngayon, Doc, Christmas, there's really a compulsion for
Mm-mm.
celebrations and getting together. Um, is it safe? But you already began saying now we need to still be careful because nasa threshold pa, it could again have a widespread.
Ako, I've
Uh,
always believed that there's a way to coexist or to live with the virus. No? In one of
mhm,
my talks, I made the point na, we were waiting for the vaccine. But, we also need to learn to live with the possibility that the vaccine might not reach our shores for a while. So how do you balance that, the need to be safe, but also the need to make sure that our economy doesn't die, the businesses don't die, our people don't starve because they don't have work, etc. So it's a very complex balancing act, but I think there's a way to do it.
mhm,
We've been fed uh, information about making sure you wash your hands, you wear your mask, you wear your face shield. And that's all
mhm,
true. That's all what's really needed. No physical
mhm.
distancing. I'm sure when we talk more, a little bit more about this, I will repeat. I will keep on repeating those same things: mask
That's
wearing,
right.
hand hygiene, or alcohol hand rubs, physical distancing, keeping groups small. Um,
Mhm.
in when we talk about Christmas, for feeling social beings. And worldwide naman, Christmas is
Mhm.
celebrated, some for the wrong reasons, but for us Christians, we have a really good reason to celebrate, and we want to really celebrate it the best way we know how. But sabi nga nila, di ba, the best way to show love these days is to really keep your distance. So if you don't
Mhm.
belong to the same household, it 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 might be best, at least for this season, no, to maybe postpone physical meetings, just so
Mhm.
you get to protect your loved ones.
I see, I see. We'll talk more about that, no, yung apat dapat. It's a very good way to remember things, and it was courtesy, of course, by our medical practitioners, the Association of Medical Practitioners. Um, Doc, yung bang, what is, kasi we hear a lot about how the virus spread, no? Sa ngayon ba, saan pinakamataas, anong context yung pinaka, in your data or observation and information you have, saan pinakamalakas yung hawahan ng
Okay.
COVID-19?
I want to address that properly. If I can call one slide lang, I think the first one
Okay,
that I okay, the slide one po.
that one, yeah.
Yan. Okay. So there are three ways to transmit COVID. One of them is the major way, and then like two others that can also transmit. So you see on your screen on the left an infected person, someone with
Mhm.
COVID, and on the right is a susceptible host or someone who doesn't have COVID and can get it. The main mode of transmission really is by droplets. When we say droplets, these are pieces or particles of saliva. The
Mhm.
bigger the saliva, the bigger the drop of saliva, the heavier it is. No? So when it's heavy, if it's big, it falls to the ground immediately. So
Mhm.
droplets or saliva that are more than 5 micrometers in diameter, they're classified as droplets or respiratory droplets. And because they're relatively heavier, they fall to the ground within 6 feet. And that is the origin of our recommendation that you might, you stay away from the next person at
Mm.
least 6 feet away. Oo.
Yun palang dahilan mo, no?
Sabi natin, di ba, 1 meter is good, more than a meter or 2 meters is best. No?
Best.
Just sometimes hindi talaga pwede 2 meters, no? So we really need to make do with 1 meter. But it's 6 feet of distance kasi the droplets will fall to the ground before 6 feet. That's the origin of that recommendation. And when a person who is unmasked, na susceptible host, inhales the droplet, then that's when he gets infected. Now the virus will start to latch on to the cells in the airway and start replicating in the cells. Now, when a person who's infected coughs or sneezes, no, there are some particles, respiratory secretions that become very small, so less than 5 micrometers, and these are the ones that can stay suspended in the air. Evidence has shown, so there are many scientists that show these very light particles can remain suspended in the air and infect other people. No, and it has been proven. Initially, kasi there was some confusion. The WHO was saying, no, this is only droplet. It has something to do kasi also with how we protect ourselves in the hospital, yung aerosol transmission. But the evidence also shows that in most cases, aerosols play a huge part only in hospital. So when there are medical procedures and the patient violently coughs or sneezes, or when the patient is intubated, or meaning malagyan ng breathing tube. In most cases, don't really play a very large part in transmission, but it can. Now, when droplets or aerosols fall to the ground or to a surface, a table or a chair, and then someone without COVID wipes the table, rubs his eyes, rubs his nose, that's also how you can get COVID. And that kind of transmission is called fomite transmission. So those are the three ways. Going back to the original question, your original question about how to transmit, it's really droplet transmission. That means the most effective way to transmit is a symptomatic person, someone who has symptoms, ubo, sipon, doesn't wear a mask, and then spreads it around in a room. That also means that rooms that have poor ventilation will facilitate transmission because the virus tends to stick around and remain suspended in the air. So about the recommendations later on, these are the things to remember how the virus is transmitted.
Siguro isang one question that might pop in someone's mind. If you're less than the recommended distance of 1 meter or 6 feet, no? Ba yun, Doc? But
actually, ang 1 meter is
wearing
3 feet yata eh.
3 feet, sorry, yeah. Yeah, 2 meters pala yung 6 feet. But if you are wearing mask and the other infected person sneezes or cough, is it still possible to ingest it dun sa isang
it becomes much less. The risk for you to get infected that way becomes much less. The purpose of a mask is twofold. If you are symptomatic, then you don't spread the virus around. It gets caught
in the mask.
So it's aerosolized before it even in the air. It gets trapped in the mask. But the second purpose is if someone sneezes in front of you, you are also somewhat protected. But I like to believe that the main purpose of what's called universal mask wearing, getting everyone to wear a mask, is that in the event that someone is infected, meron na agad source control na nakalimit na infected particles with mask, then he or she doesn't
I think like free seed doc. Oh yeah. Yeah, we got that. Yes, yes. Doc, you mentioned the mask and how important it is, no? Pero merong mga nagsasabi, depende sa mask. Or will any mask do and have the same effect? Or are there, kasi there are a lot of masks that come out. Are there masks that people should not wearing or trusting?
Right. That's a very good question, and this is something that we also are trying to implement in Medical City. No, for daily use, meaning just errands. You're not going to see a patient with COVID. No? Any mask will do. Even a cloth mask will be okay. Remember, our main purpose is if you are infected, you control the source, don't spread it around. So okay na ang cloth mask, okay na ang surgical mask, yung mga blue face masks. There is we need to say something about masks with exhaust valves though. So these are masks with those plastic parang exhaust valves. So para it makes you breathe easier. Those potentially can cause problems. Because if you are infected, then that's an easy way for the virus to escape and cause you to spread the infection. The other mask that's very popular now, and I'm sorry to say this, I think that's a pretty expensive mask. Those copper masks that are very popular, those brown ones, that has a very large hole near the chin. So in terms of protecting if you're wearing the copper mask, in terms of protecting yourself, you're good. But in terms of being a good and protecting the others around you, not. Kasi the virus can escape that way and then still float around in the air. So in Medical City, what we've done is to wear a mask with exhaust valve, or wearing those copper masks to put a surgical mask over it. For healthcare workers who will see patients, it's a special kind of mask.
It's a special kind of mask. So one of our viewers tonight, si Edu Cristobal, made some comments. So sabi niya, mabilis siyang maipasa hanggang kumalat, kaya lumalala. Talagang importante raw yung disiplina talaga din. Kailangan para maupala pag nawala na COVID, kasabay siguro yung pag-angat at pag-ayos ng bansa natin. Kasi yung disiplina, kung makikitang epektibo at malaking maitutulong para sa lahat, di makakasanayan at sigurado na tayo makakaangat. So maganda pa rin yung kanyang naisin para sa ating bansa. And one of the things that happened niya yung probably this pandemic is teaching us also to be more disciplined as a nation. Pero in a way, generally speaking, I don't know, sabi nga nila may mga areas talaga na pasaway din. Pero I think generally speaking, parang mas, comparatively speaking with other nations, parang mas nag-abide tayo din sa wearing masks.
Yes, I wholeheartedly agree about that. Meron talagang situations where people violate the public health measures, yung mga mask wearing physical distancing ang issue. But I think in general, we're very good in terms of wearing our masks and even our face shields. If you compare us to some of the other Western countries, mas may hesitation or resistance. That's the term I'm looking for. Mas may resistance about wearing masks.
Oo, pero in some of those countries now, talagang ginawa ng mandatory kasi nagkaroon ng new wave of
Yeah,
spread ng virus. Um,
right. But in the United States, even if they have the worst pandemic, hindi nila magawa na i-mandate ang mask wearing.
yeah,
I think it's partly because of the culture. Asians in general, I think, are pretty good. The Philippines was late in the game to adopt that compared to our neighbors like China and Singapore and Hong Kong. And I think it
yeah,
has to do with their previous experience with the first SARS.
yeah,
Kasi
yeah.
they really had it bad the first SARS eh. So medyo marunong yung population nila.
Actually, we lived in Singapore for a while, and I think we just came a year after the SARS epidemic there or spread. And yung mga anak ko, when they were in elementary, sanay kumuha ng sariling temperature,
Yeah.
standard na yung lahat ng estudyante, meron gano'n. So, may mga protocols na sila. Anyway, may tanong tayo,
Yeah.
Doc D. Lilibeth, sabi niya, I'd like to ask a question. If you're going to the hospital for checkup, what kind of mask would be advisable to use?
Um, any mask. Kasi the mask is, like I said, dual protection. You protect yourself, you protect other people. For that purpose na you want to protect yourself and other people, any mask will do. Let's leave the more specialized N95s to healthcare workers who really need them when they actually face COVID-19 patients who are coughing and sneezing. You're free to wear any mask, but if you're asking about the bare minimum, any mask will do. Even a cloth mask should be okay.
That's very helpful, Doc. Friends, if you just join us, we're talking to Dr. Karl Henson, Director of Hospital Infection and Epidemiology Center of the Medical City. And we're happy that he's able to join us tonight. He's a fellow churchmate or a churchmate here at Green Hills Christian Fellowship, and we're glad that he has some time to spare so to help us in this conversation. Doc, isang I think critical din na malaman ng mga tao yung timeline of when you get infected, when do you get tested, when do you isolate yourself. I think when people know this, mas mitigate yung further spread ng virus, di ba?
Apo. Yeah, I can see my internet's a little erratic and I apologize for that. Medyo nag-red and green. But hopefully it stabilizes. May I have po the second slide just so we can answer Pastor Eric's question. All right, so this is important for us to know what test to use, but also understand when we are infectious. No? So that blue curve that you see right there is to simplify it, it's the virus in the airway. So it could be a whole virus, or later on it can be something else. But the live virus starts to rise about 5 days from infection. So let's begin with when you get infected. When we say infected, the virus enters you and starts to latch on in the cell, in the airway. No? From the period of infection to the time that you develop symptoms, that can take as short as 2 days to as long as 14 days. And that is the reason why we quarantine people for as long as 14 days, because the virus can take that long to express itself. No?
I see.
The implication also is, if sabihin natin, I get exposed to a person who's infected today and got infected, pero wala pang symptoms. And then I get tested tomorrow kasi natakot ako na nalaman ko positive siya. No? If that test is negative, that doesn't mean that I'm home free. No? There's still a full 2 weeks that the virus is, can express itself. And that's why if you were exposed and high risk exposure, you need to really finish the 14 days quarantine. That's the first point that I want to make. The second
Importante
point,
yun, Rep,
so,
ano? You said na
opo,
even if you tested negative, but clearly you got exposed to someone who's infected, kailangan talaga mag-quarantine 14
yes
days.
po. Kasi pwede pong mag-negative ka ngayon pero meron pa lang nagbo-brew na virus, hindi pa siya enough in the nose to turn the test positive. And
Mm.
then, sabihin natin, 5 days later, mag-symptoms ka, positive ka pala. That's
Mm.
the first point. The second point I want to make po is after you get infected, if you will look at this blue line here, no, it starts rising at -5. I don't know if you can see that. This bar right here, it says start of symptoms. Nandyan, no? Day 0 yan. And if you notice, the blue bar or the blue graph, the blue line, rise before the start of symptoms. That
Mm.
means that the virus starts replicating in your airways even before you start having fever or cough or colds. Bago ka pa magka-sintomas, pwedeng mataas na yung virus mo sa airways and pwedeng nakakahawa ka na.
Yun nga.
Alright?
Okay, nakakahawa na siya kahit wala pang symptom. Tama ba yun?
Yes po. Yes po. Pwedeng nakakahawa na siya in the pre-symptomatic phase, no? So, balik tayo dun sa na-expose, na nag-test negative pero pre-symptomatic pala siya, nakampante siya na sa negative test niya, doesn't follow the quarantine, pwede siyang makahawa kasi he got very comfortable with the negative test, doesn't take care of mask wearing, etc. So that's a second important point. You start becoming infectious even before symptoms start.
Mm.
And then the peak level of virus happens within the first few days. So patients are most infectious a few days before symptoms start to a couple of days after. And usually these are the times na very mild ang symptoms. Akala mo sipon-sipon lang, ubo-ubo lang, Kovid na pala. And these are the times when your guard is down kasi you still feel somewhat better, you still feel somewhat okay, and you haven't really developed the shortness of breath, etc. Now, in this period, you will look at the blue bar, that's nucleic acid test. So the effective or the best test to do in this early part of the infection is either an RT-PCR, meaning the regular swab, or one of those rapid antigen tests. No? Rapid antigen tests perform a little poorer compared to the RT-PCR or the usual swabs, but they both reflect the same thing. They both reflect the presence of the virus in the nasal passages.
So the
And
rapid
then,
test, Doc,
yes,
the rapid test can actually indicate that you may possibly have the virus.
we need to be careful about saying rapid test. There's a
Oh,
rapid antibody test and a rapid antigen test.
so you're talking about the
So,
necessary rapid antigen test is what?
right. The rapid antigen test po is also a swab that you poke into your nose. And then there's just a different way to process that. Pero para lang siyang pregnancy kit. Pero ano rin siya, nasal swab din po siya.
Okay.
Usually the results are out in an hour or so.
I see.
So rapid antigen po yung effective or yung pwedeng gamitin in the early part.
Mhm.
Now, when patients get sick, they get infected, so nag-positive na sila, no? Let's now look at the red line right here. No? And these are the antibodies. Now, antibodies are particles or molecules in our body that our own body produces whenever it encounters a foreign agent. No?
Mhm.
So sabihin natin may invader like a virus or a bacteria, any virus or bacteria. When the body first encounters it, there's an initial attack, no? An initial protective attack, but then at the back of the line of that, let's say cavalry or whatever, parang meron ng part of our immune system that starts to memorize and learn the features of this virus, and then it starts to make protection. That protection is called antibodies, so that the next time that you get exposed to the virus, you can already fight it off immediately. No, it doesn't get you as sick as the first time. So these antibodies start to rise about the 6th, 7th day of infection, but it's really highest around the end of the 2nd week of illness.
I see.
And these are when the rapid antibody tests will turn positive. Okay? So yung mga rapid antibody tests where you get pricked by a lancet, and then you put your blood in these parang pregnancy kits. These are rapid antibody kits. They will only turn positive around the 2-week mark. That's why there was a big controversy early on in the pandemic when companies were insisting on using these antibody tests to screen their employees to go back to work. And the doctors were saying, you cannot do that because there's this 2-week delay. No? And again, alam mo naman ang mentality, person, Filipino pa yan or some other nationality. Yet a negative test, the tendency is to be comfortable. Negative ako, wala akong COVID. So the tendency is to relax, the mask wearing, the physical distancing, etc. So if you're symptomatic, it's important for you to get the best is still an RT-PCR, a swab. RT-PCR. If hindi available, a rapid antigen test will do. But like I said, it's less reliable, especially if it's negative. A negative antigen test is not very reliable. And then if you want to confirm if you got COVID before, that's the only time really that the antibody test is useful. Otherwise, it's not as useful. And then in the infectious period, we say that if the patient has recovered, nawala na yung symptoms niya, that pretty much reflects recovery. But we say about 10 days. No? 10 days from the time of symptoms started, the time that the symptoms started, we count 10 days. Basta nag-improve na yung pasyente, wala nang ubosipon, better na siya, then hindi na siya infectious after the 10th day.
I see. Pero kung merong symptoms pa, Doc, infectious pa rin siya.
That's also another issue. In most cases, there will be a clear cut. The person will say, Doc, nawalan ako ng panlasa, nawalan ako pang-amoy. I felt really bad. I had fever, etc. And then, by this day, Doc, nag-recover na ako. Nawala na yung lagnat, nawala na yung shortness of breath, medyo bumabalik na yung panlasa. Usually, ganun yung clinical picture. But in a minority of patients, they have what's called long-haul COVID or long COVID. Pwede kasi that in some patients, it's been documented that they can have cough for weeks and weeks and weeks. And it doesn't mean that they're infectious. People will feel very weak. Some people will have parang they're extremely tired all the time. Some people have reported being depressed one time and then they're okay the next. So there's really a lot of things that we still don't know about this virus. The only things that we are sure of are the ones that happen in most cases. But these more unusual presentations, medyo hindi pa natin siya talaga alam.
Ito yung sinasabi na, Doc, na parang ano ba yung term na ginagamit? Nagiging side effect after the normal prescribed period.
Para siyang post-viral syndrome po.
That's right. Post-viral syndrome. Yes. Nako, exciting to. Doc, may mga tanong ba may tanong tungkol dito. Kilala ko po to, si Cynthia Angeles. She has a question on beauty salons. They're now open. You know, very important yan for a lot of people kasi talagang ako hindi ko problema yung umaba yung buhok eh. Pero maraming naghabaan na yung buhok na
Yeah.
hindi naman nila gusto. Kami ngang may gusto, ayaw naman. Anyway, can you get infected by having manicure pedicures, or both of you are wearing masks? We'll go back to that question just a short while. We have to pause for a break in our discussion, and we will hear testimony of someone and her journey of belonging to a small group community, which is very important during this pandemic, not to isolate yourself, but be connected. So let's watch.
Hello, church family. Grace and peace to you all in the name of our God the Father and our Lord Jesus Christ. I'm Mary Ann Reyes Tucanes, or Ann for short, and I've been a pioneer member of G4, which stands for God's Grace Growth Group. There you go. We were formed as a purpose-driven life group under Pastor Lloyd Estrada in early 2004, and despite each member's uniqueness, we just clicked, and the Lord led us to stick it out and decided to officially become a growth group. I noticed and realized, though, that the few years that I was not connected to or not part of a small group, I've always felt that chasm, that seeming gap that needs to be filled. Yes, I do serve in church, but belonging also to a growth group addresses that need to constantly and deeply journey together with like-minded believers in the faith. And I believe that the Lord wired us to be so. As He admonished in Hebrews 10:24-25, let us consider how to stir up one another to love and good works, not neglecting to meet together as the habit of some, but encouraging one another, and all the more as you see the day drawing near. Well, I'm often described as independent and strong. I don't quickly open up to others. My G4 family is the first group for me to share my deepest struggle with no dread of being judged, but instead be genuinely loved and be genuinely truly prayed for. More importantly, and way beyond that, I was prompted to stay because of, well, Christ. We grow together knowing and loving the Lord with the hope of strengthening our faith, anchored on Christ's word and message of love, hope, and salvation. Why did I stay? Commitment. We are imperfect and broken, but we commit to help carry each other's burden as best as we can. And this commitment includes accountability, and as you know, that keeps us in check and keeps us grounded in prayer. Because of camaraderie. What a blessing it is from God that we in our growth group enjoy each other's company, devoting ourselves in prayer and fellowship and more. I stayed because there's compassion. I stayed because children, that's another thing that links us, is our children, of course, and they're an extension of our growth group. And yes, we're cool, we collaborate, we fellowship through over coffee. Acts 2:42 reminds us, and they devoted themselves to the apostles' teaching and the fellowship, to the breaking of bread and prayers. Oh, that's a resounding yes. I cannot underscore enough how important it is to belong to a growth group that constantly pray for one another, exploring and taking to heart God's word, caring and building each other up, and simply being there. It allows us to let our light shine before others, that they may see our good works and glorify our Father in heaven. I believe that nothing can stop a church or a community from growing in the Lord that genuinely love and accept, appreciate, and affirm one another. Despite life's ups and downs, there's unspeakable joy and peace that only comes from the Lord, whose love endures forever and is our source of strength. And to get to experience this together with a group you belong to is a wonderful blessing. It opens doors to see the Lord's purposes in our lives, to obey Him, and to even step up to His call. So for those of you who are not yet part of a small group or are still on the fence whether to join or not, please, I encourage you not to let this opportunity slip away. Join a growth group, be blessed, and be a blessing. Thank you.
Thank you very much, Anne, for sharing your journey with us. And yes, if you don't belong to small group, we highly encourage you. Here in GCF, we call it growth group. We're meant to grow in our life journey with other people. We're talking to Dr. Karl Henson of the Medical City. He's the Director of Hospital Infection and Epidemiology Center of the TMC. Doc, kanina we were talking about masks. No, we missed one question. Sabi, how often do you dispose the mask? O meron ba siyang lifespan or hours? So, should be
A good index is if it's soiled or if it's wet. As we speak, the mask will accumulate. Kasi yun nga yung job na is to catch our secretions. So once it becomes moist or wet, it's time to change it. For cloth masks, it's a good idea to change every day. For nurses and medical personnel, they're instructed to change their masks every 8 hours. If you have the supply, that's another good way to do it. Kasi nurses will be wearing their masks the entire shift. So by the time that 8 hours is done, talagang na siya, very used, and it needs to be discarded. So at 8 hours or once a day, it really depends. But if it's soiled na, mukhang talagang meron ng stain, that should be changed.
I see. Well, thank you. Now we go back to that question. For some, it's really a necessary thing na yung pedicure and all of that. And then for some, kailangan talaga nila magpagupit. Paano bang protocol doon na medyo safe ba siya? Or how do you stay safer?
I think the IATF has done a good job with indicating what the preparations should be for barbershops and salons. No? They have switched. Ang simple answer dyan is I think if done the right way, it's safe. I've had several haircuts since the pandemic started. I've had my nails cleaned in Bruno's a couple of times. I haven't had COVID. But the key there is doing it correctly. So in salons and barbershops these days, usually, di ba dati cloth yung nakalagay over the cape, yes. So ngayon they switched to something that's single use. Some use paper, some use plastic. The barber or the stylist is wearing a mask and a face shield, which must not be very comfortable for them, but they are protected that way. The mask when you get a haircut is not removed unless i-shave na yung part na yan. So those little things, I think they are good small details that were considered. Pero syempre, pa rin, we go back to the basics. If you don't need to be very close to someone, you stay away. So the barber, that's a risk for him as well. No? Pero dahil protected naman siya, it's the risk is lessened. Wash hands the equipment, the material, the utensils, the scissors and all need to be disinfected every time. Yeah.
Yeah, yeah. The other one I wanted to ask you uh, sa dental visits, no appointment, is it
Yeah.
safe, dangerous?
Yeah. Um, more than the patient, it's really the doctor, the dentist who's at risk.
That's right.
Because it's the patient opens his mouth and my mom is a dentist,
Yeah.
and she has started seeing some patients. I believe she does symptom screening, meaning nagkaubo ka ba? Yan. The thing with my mom kasi is she knows her most of her patients, all her patients. So na sa screen niya yung mga um, one na risk stratify niya in her own way. And then she has the protective gear. So I know Pastor Jello is a
Yes, yes.
dentist din, di ba? And
Yeah.
he, I think, continues to see patients. So the point I'm making is there is a safe way to do things.
Mhm.
No, it doesn't have to all stop and grind to a halt.
That's good to know, no? Because many people are talagang nade-depress na halos kasi parang life is disturbed, we can't do anything. So there are
Yeah.
ways to stay safe and continue to do the necessary things that we are supposed to do. There's a question here from a medical perspective. Is it recommended for churches or any establishment to open during this season?
The same answer. No, there is always a safe way to do things. For churches, they need the church leaders need to be thinking about how to observe physical distancing, how to provide alcohol hand rubs for the attendees, the church members, what to do when singing. Ano ba yan? Magtatanggal ba ng mask? Dapat hindi. So those things need careful planning, and I think that GCF has done a good job in preparing for live services. It's unfortunate lang talaga that we cannot at this time go back to the used to a jam packed full house. You really experience the warmth of everyone in the auditorium. It's just not possible at this time, and it might not be for a while. But it, like I said, it is possible. We just really need to make the proper preparations.
That's good. That's good to know. Um, there's another one here from Maria Carmela. You don't know. Doc, is it safe enough in an enclosed area with masks, shields, constant disinfection of air and surfaces, and alcohol, and once in a while opening door?
In an enclosed, so is it safe enough in an enclosed area with masks, shields, constant thing?
Siguro
Yeah,
pag
so
ini-imagine niya pag may gathering, no, sa bahay or sa family, what can people do?
ano yan eh, we need to think about it as level of risk. Level of risk. The highest risk is in enclosed spaces and the person who's infected is not wearing a mask. That risk decreases a little bit if the person infected is wearing a mask kasi may source control, but still relatively high risk. You go down that list of risks and you see that well-ventilated spaces are the best ways to go about it. So open spaces, parks, etc. Kasi pag buga nung infected person, it gets mixed into the air, no? And it really drastically reduces the likelihood that the virus goes into another person. So there's always this parang level of risk that we need to consider. Enclosed spaces, definitely not so good siya, pero if but there are ways to increase ventilation, opening windows, putting in HEPA filters, etc. So pwede yun. Pero the question is it safe enough? Again, it has to do with the level of risk. It's difficult to give a one a one-word answer to that.
All right. Maybe we can, I think you have a slide, Doc, dos apat dapat. That's a very helpful.
Yeah.
Uh,
Before the apat dapat, can I have the third slide po? I want to start with that.
Okay.
So this is the Swiss cheese respiratory virus pandemic defense. No, so if you're familiar with the Swiss cheese, it has many holes, and the holes don't really line up. No, masarap. If you're not familiar with the Swiss cheese, but you're old enough to remember Tom and Jerry, no, the kind of cheese that they play around with, the may malalaking holes, that's Swiss cheese. And if you look at the model here, there are different holes, but they're not all lined up, and that's the way that we should see the how we protect ourselves. There's no single intervention that is perfect at preventing spread, and in this particular graphic, it's split into two: personal responsibilities and shared responsibilities on the right. So personal responsibilities, ano yan? Physical distancing. If you are sick, if you are symptomatic, you stay home. You wear your masks, and then you practice good hand hygiene and cough etiquette. When we say cough etiquette, you use the crook of your elbow to catch your cough, or you use a handkerchief. Avoid touching your face in general. That's the best way to get infected, is if you have an unwashed hand. You rub your eyes and your nose. And then if crowded, you limit your time in that area and you try to stay away from other people. You don't get too close. So these set of interventions, when done na sabay-sabay, that will already create an impact and prevent you from getting the virus.
Mm-hmm.
Add to that the shared responsibilities, where testing and tracing, something that the government will have to do for us. We'll make sure that the room is well ventilated. We plan for outdoor activities if it's possible. Government messaging, financial support, etc., and then vaccine. So because the holes here, nothing is perfect, but if the whole, then there's a high likelihood that you will never catch the virus if you practice these set of recommendations. Now, the HPAC, which is the group of doctors that was formed around the time that we asked for that timeout, if I may have the next slide po, simplified it for us. Instead of remembering all that, they created they came up with a creative acronym. Apat dapat. A is for air circulation. Dapat may sapat na ventilasyon sa isang lugar. So if you're in an enclosed space and there's a window, you might want to open that window. If wala talaga, maybe consider moving that activity to another space. Physical distancing of 1 meter or more is P. P is for physical distancing. Siguraduhin isang metro ang layo or more. Sabi natin, 1 meter is minimum. And then always wear face mask and face shield. Ang letter A, always. So if you're not eating, you need to be wearing a mask and your face shield. And then letter T is 30-minute interaction or less. Actually, sa hospital, when we talk to nurses and think whether they caught COVID or not from a patient, we use 15-minute cutoff. Pero since we're not in a healthcare setting, the HPAC is a little more generous, 30-minute interaction or less. So if you must participate in a group activity, you want to limit the time that you're there to 30 minutes or less. That way, you really decrease the risk of you getting COVID.
I see. So in the hospital setting pala, mas tight yung window. Lang 15 minutes.
Kasi po may sakit na talaga yung pasyente. Known COVID cases na yung parang ganun ba? Kaya we're a little more stringent. And the implications kasi are enormous for if we miss someone who's sick and then that patient continues to see, or that employer or employee continues to see patients, diba? Kawawa naman yung patient. So we're a little more strict with healthcare workers.
Right, right. Now, families will be gathering. Yung apat na binanggit natin, yung apat na dapat. Ano Dok kung isa ay absent? Ano ibig sabihin nun? O dalawa lang ang present o nafa-follow?
So, again, it has to do with level of risk. No? Ibig sabihin, aakyat yung risk. It doesn't mean that you get COVID immediately, but the risk will be higher. No? And we go back to the Swiss cheese model. Kung one of the four is not there, there are three others to protect you. For example, your family really, really wants to spend Noche Buena. I can't imagine a Noche Buena lasting just 30 minutes. No? Just make sure that you guys are wearing masks if you eat, and at the time that you're eating, magkakalayo kasi you will be removing your face masks. No? And then you want to make sure that there's adequate ventilation in the room, etc. So things like that. In the let's see, this is a way, the apat dapat is a way that the HPAC came up with to understand the need to socialize sa Filipinos. Kasi mahirap mag-recommend na no gathering, nothing, parang gano'n. Hindi mo pwedeng sabihin kasi yun eh. So, parang this is sort of a guide. If you really must gather, then you can do the following. No? So parang it's a way to mitigate or to sort of control the risk of you getting COVID. Testing, I don't think will help. It doesn't matter that you get all antigen tests before you gather, because there's a risk that you might be infected and the test will be negative.
That's
so
right.
parang these are the basic requirements or basic things that you can do to protect yourselves and your loved ones in this holiday season.
That's right. So, something to remember, friends. So, yung apat dapat siguruduhin na there's good air circulation sa, mas maganda nga kung outdoors inyong. I heard one person, different households sila, pero sa labas din, sa garage area na open airs. Pero per table are the same households. So,
yeah.
May mga ways para talaga of doing it na safer. Pero important
po.
Doc, no, yung pagkakain, kasi tatanggal ka ng mask, kailangan magkakalayo.
That's an important point actually. Kasi sa hospital, yes, there have been some workers who got sick from patients. Pero by far, the more common way to for that employees got sick is through a coworker. Masyado silang na-excite from not seeing each other for many weeks and months, no? They ate together, shared sausawan together, and then yun pala, they were sick. No? So eating meals are actually a high-risk activity because we remove our masks. So that's something that we need to remember as well.
Yeah. May mga invitations nga ngayon for lunch out. It sometimes you have to just bite the bullet and say no at times, so just to reduce the risk then for both of you, di lang for you. Well, Doc, final comments. Our time is up. Any last words from you and how people can be safer during this season?
I had a good thought and then it went away. Number one po is I don't know by now, it's a COVID cliche siguro to say that the best way to show love is to stay away for now. No, if it can be helped, postpone the gatherings until we all get vaccinated, or do things by technology, by Zoom or parang ganun. So that's one important way, and I think there's still there we can find ways to experience each other's company, and we can still feel warm by communicating and by spending time, but in more creative ways.
Mm.
We're hoping that we control the pandemic within the next couple of months, so that by next Christmas maybe we'll be back to some semblance of normal. Pero while we're in this pandemic, while we're dealing with this virus, and while we don't have the vaccine yet, I think we really need to sacrifice a little bit and maybe postpone some of the things that we were planning to do.
Yeah.
But eventually, bottom line is, if kailangan talaga, there are creative ways to do it.
I like what you said na baka Christmas 2021, one Christmas away. If we are able to do our job now, at sacrifice a bit, we may have a more normal celebration of Christmas 2021.
And for our high risk loved ones, we want them to be alive in
Yeah.
2021.
Yes, yes. So, friends, I hope this has been a helpful conversation about Christmas in a COVID world. And thank you, Dr. Karl Henson, for a very informative and very helpful evening of being informed. So we will know how to trace a timeline, what tests to take, the importance of masks, and na-correct din yung ibang mga dami kasing floating information about these things. And it has been really helpful. So thank you so much, Doc.
You're welcome. It has been my privilege po. Thank you for inviting me.
Yeah, and we're always praying for you, the mga frontliners natin, fighting the virus. In a way, the virus, not to diminish people that have suffered and lost their lives and continue to suffer because of it, but it has simplified our lives in many ways, removed a lot of distractions, and so that we can focus on the more important things and people that are near to us. And of course, God, and the celebrant of Christmas. And we hope that you also will spend a little bit of time really thanking and offering your time and your gifts to the real celebrant of this Christmas, and who brought us hope that can carry us not only through this pandemic, but even through the beautiful ending of things when the time comes, renewal of every returns through Christ. So once again, thank you so much for joining us. I'm Eric, Pastor Eric Dizon, and this is the Belonging Podcast of Green Hills Christian Fellowship. We'll see you again next Wednesday at 8 p.m. Good evening and God bless.